morning. My name is Kim Rose. I'm the manager in diagnostic imaging and diagnostic cardiology services here at CMH. Thank you all for joining us this morning as we celebrate Cambridge Memorial Hospital's official site designation as an Ontario Breast Screening Program Assessment Centre. We are so pleased to have so many people join us to celebrate this milestone with us today. To provide a little bit of information on the program, the OBSP program recommends that most eligible women, two-spirit, trans, and non-binary people aged 50 to 74 be screened with mammography every 2 years. Once patients become enrolled in the OBSP program, patients will receive the reminders for their next screening exams, receive their screening results, and receive help on how to follow up on abnormal results after their screening mammogram has been performed. CMH has supported approximately 2,700 patients on their journey through the program in 2022 alone. Our DI team is a collaboration. Patients are supported on their OBSP journey by our amazing technologists, sonographers, radiologists, and clerical staff who are here to support each step of the way. We also receive tremendous support from our regional partners as well, some of who have joined us today in our celebration. I would like to introduce our speakers for this morning. First, we have Jane Martin. Welcome, Jane. Jane is the Vice President of Clinical and Diagnostic Services and the Regional Vice President for Waterloo Wellington Regional Cancer Program. Jane is going to speak to everyone about the benefits to the system related to the program this morning. We also have Ken Abogadil. Ken is our director here in diagnostic imaging. Ken will provide some additional information on the benefits for everybody of this OBSP site designation to CMH. We're also joined by Dr. Winnie Lee. Dr. Lee is Cambridge Memorial Hospital's Chief of Staff, as well as our DI Chief of Radiology. Dr. Lee is going to expand on the medical and patient benefits of the program for everybody. And we are also very fortunate to have a patient with us today. Welcome, Susan. Thank you. Susan will speak to everybody about her personal journey here through the program. So without further ado, I would like to begin and welcome Jane. Thank you, Jane.
So good morning, everybody. On behalf of the Waterloo Wellington Regional Cancer Program, I'm absolutely thrilled to be here to celebrate the opening of the Breast Assessment Center at Cambridge Memorial Hospital. I know you opened in April, but I think it's very appropriate to be celebrating in October, being Breast Cancer Awareness Month. This center will be the third in our regional cancer program. We have two other breast assessment centers. One is located at Grand River Hospital Freeport campus, and the other is located at Guelph General. And the breast assessment centers really open up access to screening, assessment, and diagnostic services for our residents, not only in Cambridge with the opening of this assessment center, but also for the residents of Waterloo Wellington. In alignment with our Ontario Health Cancer Care Ontario plan, as well as our Waterloo Wellington Regional Cancer Plan, we're really excited about the strategic alignment of equity and access. And having this assessment center in Cambridge will afford patients more choice, decrease wait times, as well as improve the quality and access to assessment here. Again, I would really like to recognize the strong partnership that we have with Cambridge Memorial Hospital and really commend you on your desire to improve equity, access, and the quality of care for breast assessment, screening, and for diagnostic imaging. I'm thrilled to be part of your opening and congratulate you on this achievement and significant milestone.
Thank you, Jane. Great. And then we have Ken. Thank you.
Good morning, everyone. Thanks so much for joining all of us. We are very happy to celebrate Cambridge Memorial Hospital's celebration as we are designated as the third Ontario Breast Screening Program Assessment Site in the Waterloo Wellington region. Being an official assessment site is a testament and recognition to the DI staff, our clinicians at CMH, our DI technologists and radiologists who are involved in the patient breast assessments, utilizing their high level of competence. And becoming an affiliated OBSP assessment center enables CMH to continue providing a high level of quality assurance to patients post-breast screening, which contributes to the high level of quality of care and timely diagnosis. And as we celebrate Breast Cancer Awareness Month, this month we at CMH Diagnostic Imaging Program would like to express our gratitude to the Cancer Care Ontario through the Waterloo Wellington Regional Cancer Program for this recognition. This strengthens our commitment to continue delivering breast cancer screening and breast biopsies to all our patients within our facility. Ultimately, CMH welcomes the opportunity to continue its collaboration with the Waterloo Wellington Regional Cancer Program to help improve health outcomes in breast cancer prevention, early detection, and treatment. And now I'd like to invite Dr. Lee
Thank you.
to say some words.
Good morning, everybody, and thank you all for joining today. On behalf of the Diagnostic Imaging Department, my colleague, Dr. Inga Isipov, our Deputy Chief of Diagnostic Imaging, who unfortunately couldn't be here today, we are so pleased to celebrate this momentous milestone with all of you. Our new designation of a formal OBSP Breast Assessment Center is a very exciting one for the breast screening program at CMH. It is a true testament to the hard work of a multidisciplinary team over many years. Our technologists, our radiologists, our surgeons, our pathologists, looking around to see if they're here, and our wonderful support staff who help patients navigate this complex system. The OBSP Assessment Center is really a designation that demonstrates Cancer Care Ontario's commitment to breast cancer screening and prevention, and its confidence in us to allow us to further build on streamlining the breast imaging journey for our patients. I cannot tell you how important breast screening is. Every day, we encounter breast screening mammograms with findings that we appreciate the impact of it on patients. We think to ourselves, I am so glad she came in today for a mammogram. As a breast screening assessment center, we can detect breast disease earlier and perform further diagnostic testing and treatments. On behalf of my colleagues, we look forward to growing this program in partnership with our regional cancer care program. And with our new designation, we are striving to provide exceptional care and exceptional breast cancer screening for our patients in Cambridge North Jeffreys and the Waterloo Wellington region. Thank you all for joining us today.
Thank you. Susan, would you like to say a few words for us? Thank you. Welcome.
Good morning. I'm Susan Grenville, and my breast cancer was diagnosed here 8 years ago. So I have been a client for an extended period of time, and I am very happy to say that I look forward to coming here. One, because I know afterwards that I don't have breast cancer anymore. And two, because the consistency of coming to the hospital, even though the footprint changes, and I frequently have needed a volunteer to get me to the department. I like the fact that when I come here, I pretty much always see Sonia year after year, which is good. But now my daughter comes, and she comes every 2 years. She's 54 years old. We did have I'll tell a funny story, that last week when I came for a mammogram, I told Sonia a story about my family, and it turned out my daughter had been here the same week, and she had told the same story. For many women, it's very difficult to go for a mammogram. It is not the most pleasant thing to do. When I lived in Timmins, I made sure I saw the same mammographer each time. I'd make an appointment to know she'd be there, and I could chit-chat. And I like the fact that I can do that here as well. I would come anyway, but it is nice, that consistency. I think it really, really comforts women when they're coming to do something that is not fun anyway and is a little frightening until you receive the report. This week, I came on Friday, very late in the afternoon, and I already had an email from my doctor on Saturday saying that my results were normal. That is wonderful, a wonderful treat for women who are waiting for their results. So I thank you all I thank the people who are involved in the region, regional cancer care. Cambridge Hospital also is wonderful. Ask me back when you wanted me to tell you about your cancer clinic.
Thank you, Susan.
Hey, go ahead whenever you're ready. Yay!
Yay!